log on so we can have a quorum.
I just told Corey to postpone going live until we had a quorum.
Yeah.
Hey, how are you?
Great, there you are.
Good to see you.
We're okay.
Yeah, I know.
I'm gonna delay
Yeah,
calling. I'm gonna delay calling into order. It is 7, but if we could take just a moment, see if someone else joins the call.
Alan Hooker.
Oh,
There you go.
6. All right. Does you want to start the meeting? There we go. All right, we'll go ahead and call to order this Wednesday, May 20th, 2020 meeting of the Lee County Board of Health. So because we have people calling in, I need those of you that are calling in to state your name so that we can have a roll call for Ms. Patina.
Dr. Hall.
Dr. Hall,
Dr. Loudon.
Dr. Loudon, and
Alan Hooker.
Pastor Hooker. Thank you. All right, with those board members present, we do have a quorum. First item on the agenda is approval of the agenda. Do I have a motion to approve the agenda?
I'll motion.
Second.
All those in favor say aye.
Aye.
Any opposed say nay. Okay, motion unanimously passed. Next item on the agenda is the approval of the minutes from our April 15th, 2020 meeting. Before I call for approval, is there any comments, any concerns, anything, any changes? No. All right, do I have approval of the minutes?
I will.
Ms. Dodson makes a motion. Do I have a second? I have a second.
optional pen. Use the top.
All right, we have a motion and a second. All those in favor say aye. Any opposed, say nay.
Aye.
If there is no one opposed, that is also unanimously passed. On to public comments, agenda item 4. Mr. Kane, is there anyone logged on for a public comment?
No, ma'am, there's nothing here.
Hi, this is Dickie.
Oh, okay, Ms. Sloop has joined us. Welcome, Ms. Sloop.
I think I heard
Hello?
Mary Holly. I said,
All right, we have Ms. Sloop has now joined the meeting. Okay, so without any public comments, we're going to go on to agenda item 5, our action items. Mr. Kane.
yes, Madam Chair, this evening I think we have 4. Forgive me for not having it up at this moment. The first action item, thank you, sir. First action item this evening is a request submitted from WIC. They had some special funding available for the counties if we reached out and had some extra resources we might need as far as our WIC program. We had to apply, and it was like last year, if the board remembers, it was a very, very short window to get this back. We did apply with the board chair's permission to move forward. I'm asking the board this evening to allow us to approve and accept the $39.89.60 for the 6 laptops and accessories. One of the challenges during this COVID-19 process, one of the many challenges, was trying to have be successful in our telework process, and we did not have enough laptops at that point to let some of them go home and work from home, which would have been allowed by the state. So they were here in our office working. So this will allow new laptops to be purchased. So if the case this happens in the future, we'll be more prepared to look at that from their perspective.
Excellent. Any discussion before I call for a motion? All right, do I have a motion to apply for and accept the special funding grant?
Motion.
Okay, let's see, who made the motion?
Mary.
Mary Holly Oates made the motion. Do I have a second?
Second.
Second.
You can have it.
Dr. Hall is my second. All those in favor say aye.
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 Any opposed say nay. All right, excellent.
Dr. Hull's on the call, because Dr. Connect is at the meeting now, he just texted us.
Okay, so that motion is passed on to approval for the recommended budget, and Dr. Connect is now on the call, so excellent, thank you. Mr. Kane?
Madam Chair, and board members, this evening I present our recommended budget for 2020-21. It has definitely been modified from the request we were looking at just a few months ago, and I'm sure the board understands why. We were looking at quite a few things to expand our outreach in the community, maybe 2 to 3 months ago, and right now we're looking at the dynamics to maintain what we're doing and also try to add a little more during that process. What you're seeing is 2 different pots of funding that do equal 169, I'm looking for the number right now, $169,083. We are wanting, with the board's approval and the commissioner's approval, to use escrow funds in our clinic program for approximately $62,000 of this. The county appropriation is primarily with the potential new environmental health employee, which will be on next year's recommended budget, but with the items that need to be purchased and resources to assist that person to perform his or her duties. The other dynamic of that, which was added really late, we have a vehicle outside that is, I think it's a 1998 Chevrolet Malibu that has seen better days. So they did allow us to look at a new vehicle to replace that vehicle for next year. So that's primarily 95% of the county expenses. So.
All right, any questions for Mr. Kane before I call for a motion? All right, do I have a motion to approve the fiscal year 2021 recommended budget for the Lee County Health Department?
So
Motion.
moved.
And who made that motion? Can you state your name? Sorry.
Mary
Mary Hollywood.
Alice Hooker.
And do I have a second?
Second it.
Alice Hooker. Second. All those in favor say aye.
Aye.
Aye. Aye.
Any opposed say nay. And does Dr. Connect, do you need to abstain? And Dr. Connect abstains.
Thank
Okay, motion passed, thank you. Okay, Mr. Kane, next action item.
Yes, Madam Chair, this evening we have the contract from our maternal health clinic. The only changes it's on from this year versus last year is Central Carolina took over the practice that we were using, so we did change the name, but there was no expense modified with the contract. They were acceptable with the amount we were giving last year, so that is approved with the $31,200 that we approved last year's budget as well. And this will have to go to the commissioners for their approval separate from the budget because of the amount of the funding.
Okay. All right, any discussion or questions before we call for a motion? All right, do I have a motion?
I'll make it.
Do I have a second?
I'll second.
Second.
She can have it.
All right, all those in favor say aye.
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 Any opposed say nay.
Dr. Holstein.
Dr. Hall abstains? Yes, ma'am. And this has to go to the commissioners. Does Dr. Connect need to abstain? Dr. Connect, do you need to abstain? I'm not sure. Before I pass this, Dr. Connect, do you abstain from this?
Yes.
Do I still have enough?
Did you hear me? Yes?
Yes, sir. We're just counting up the,
Yeah, we
yays.
just have to have
I'm
members
good.
present.
Okay.
The majority
Good.
covers that.
All right, motion is passed. Thank you. Okay, last action item.
Madam Chair, this evening, the last action item is the School Nurse Funding Initiative, annual amount of $150,000 to assist this funding for the school nurses. There's no change in this contract from last year, and as of the previous contract, this will have to go in front of the commissioners at their next meeting. So we will be submitting this probably tomorrow if the board approves for their next meeting as well.
Okay. Any discussion? If there is not, do I have a motion? Motion to accept the memorandum agreement between the Lee County Schools and the Lee County Health Department. Do I have a motion to accept it?
Move. Hello.
Alice Hooker makes the motion. Do I have a second?
Second. Sandra Bullock.
Sandra. Oh, okay. All right. All those in favor say aye.
Aye.
Any opposed? Any opposed say nay.
Abstain.
Was that Mary Holly Oates abstaining?
Yes, ma'am.
Yes.
And then this does have to go in front of the commissioners, correct?
Yes, ma'am.
Dr. Connector, did you also abstain? I'm sorry, it's very hard for us to hear. Sorry.
Thank you.
Like, he can abstain also. Okay. All right, and any opposed say nay. I don't know if I called them or not. All right, motion passed. Wow, this is a little bit of a learning curve for myself, to be able to hear and move along smoothly. Hasn't happened yet, but we'll keep trying.
So that's a new normal.
It's the new normal. Wow. Okay, on to update information. Mr. Kane.
Yes, ma'am. Madam Chair, there's only 2 items on this section this evening. Just wanted the board to be aware of the Board of Health vacancies that would come into effect in July. Dr. Schaller and Ms. Mary Holly Oates, Dr. Woodell, and Mr. Gunter, their terms would be expiring in June. And I do have an application sitting here. If anyone wants to fill it out, I can submit that back to Jennifer probably tomorrow if there's an interest. Or if the board has an interest, is on the phone, I can email this out this afternoon or this evening so you can get a copy.
All right. I got my copy right here, so we're good. All right. And then the monthly management and activity numbers. Anything you'd like to point out for that, or anything we should draw our attention to specifically?
Keep in mind, we did not share this information at our April meeting just because we were trying to limit the amount of time we were in the same room, and we were still kind of figuring out our new normal.
Right.
So the numbers for March and April, as I've told the board and as we've shared, we have cut back clinic services, which I have shared in the past, but we're still being inundated with calls from that dynamic. And since the new guidance has come out late last week, early this week, we have a newer need for more testing that the state's pushing, and the guidance around that has changed tremendously. So we'll be seeing more of an uptick in cases as far as being tested. I hope that does not correlate to a number of increased positive cases, but at the same time, we are seeing our mandated family planning, maternal health, STD clinics, things of that nature, which are required. But a lot of the other patients, we are putting and postponing their appointments until we can kind of get better acclimated to what's going on in the community. So that is one piece of information I do want to share. And you'll see with the budget that was approved a few minutes ago, we mentioned another environmental employee. It is interesting to notice that the numbers for our on-site program continue to remain up during this process. So what we were seeing maybe a year ago with 6 to 10 applications per month, we have pretty much sustained almost double that over the last, especially the last couple of months, last 3 or 4 months. But that is a good sign. Hopefully this dip will only be a dip and not be more than that. They have done if you can see on page 26, the funding for that program, we projected 150,000 and they're at 182.2 at this point. So that is a drastic increase from what we expected, which is great. I mean, it really is, but we've got to meet the need of the community on the back end to make those resources available so they can get what they want.
Right.
So it's a positive, but it also shows that we're more active than we were a year ago as far as the economy goes, and I hope that continues and we have a small dip instead of an extended challenge for the community and for the state. I do want to point out, as it's been pointed out before, Amara is back. She got back Monday, I think, Bettina. So I've missed her. And I do want to, I did want to say one thing, and I did not say earlier with the budget, but in speaking with Dr. Crumpton and Lisa, the animal shelter is remaining in the health department for the next budget year.
Okay, great.
It was not considered to go to the sheriff at this point. So I'll be glad to answer any questions, but their euthanasia rate at the shelter is really great,
Sure is.
especially with 2 staff really for the last quite a few months. So
Fantastic.
blessed to have great staff.
Absolutely. All right, if there is no further information update, I need a motion to adjourn.
Motion.
Do I have a second?
I'll second.
All those in favor say aye.
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 Any opposed?
Aye.
Any opposed, say nay. All right, without any further business, thank you all very much. This meeting is adjourned. Thank you.
Thank you.
Good night.
Good night, thank you.
Good night.